Welcome to The Explainer. Today, we're exploring fascinating and, to be totally honest, kinda unsettling reality about our own biology. It's this idea that feeling perfectly healthy doesn't actually mean you have perfect health, right? We just naturally assume that if something's wrong, our bodies are gonna let us know. We'll get a fever, we'll feel pain, some big dramatic warning sign. But as we're gonna see today, relying completely on how you feel, well, it can sometimes be a really dangerous illusion.
Okay, let's dive into this. Picture waking up tomorrow morning. You feel absolutely great. You had to work, grab a good lunch, hit the gym, and just go about your day completely normal. But what if, right at this very second, somewhere inside your body, a medical condition is actively developing? There's no pain, no red warning lights flashing on your body's dashboard, just complete and utter silence. And this brilliantly illustrates our core problem, the iceberg effect. Up on the surface, which is how you feel, it looks like smooth sailing, right? No pain, totally normal life. But beneath the surface, hidden away from your daily awareness, cellular realities like arterial plaque buildup or microscopic bone loss could be quietly progressing. The huge takeaway here is that we literally cannot diagnose our overall health purely by how we feel on the outside.
Section 1. Unmasking the hidden diseases. To really unmask these threats, we have to look at conditions that operate entirely off the radar. The source material outlines 20 specific health conditions that can hide for months or literally even years. Now, don't worry, the goal isn't to make you panic over every little twitch. Actually, the vast majority of these are incredibly manageable if you catch them early. Take the major metabolic and heart threats. High blood pressure is the classic silent condition. It can spike dangerously without giving you a single headache. Same goes for your LDL cholesterol or plaque buildup. Even prediabetes and early coronary artery disease can progress for years, quietly stressing your system without ringing one single alarm bell. Oh, and an abdominal aortic aneurysm? That often produces absolutely zero symptoms until it becomes a literal emergency.
Then we've got the quiet infections, and man, these can be incredibly stealthy. Things like chronic hepatitis B and C can hang out in your liver for years, doing silent damage. The amazing news, though, modern antivirals can cure most hepatitis C, but obviously only if you actually know you have it. It's a similar story with HPV, which can cause abnormal cellular changes, or sexually transmitted infections like chlamydia, and even HIV. These can fly totally under the radar for long stretches while they progressively damage your immune or reproductive systems. Our final category covers structural and organ threats. From the filters in your body, like your kidneys and liver, to the literal framework holding you up, your bones. Major decline can happen long before you ever feel fatigued or suffer a sudden fracture. We see this exact same stealth mode in early glaucoma, damaging the optic nerve, precancerous colorectal polyps, and even early cognitive impairment, where subtle memory changes are just so easily brushed off as normal. In those early stages, these conditions produce exactly zero obvious warning signs. Section 2, why your body stays silent. Now, what's really interesting about this slide is the biology of it all. How do these conditions just set up camp inside us without our bodies screaming for help? Well, the first reason is this fascinating yet kind of double-edged evolutionary trick called functional reserve. Basically, it's your organ's built-in backup capacity. Think of it like a hospital's backup generator. It lets the organ keep doing its job even after taking significant damage. Your kidneys are a perfect example. They're so incredibly efficient at filtering your blood that they can lose a massive chunk of their function before your body starts falling behind and throwing up symptoms like swelling or nausea. It is an absolute lifesaver in the short term, but it acts as a mask in the long term. The second reason is that your brain is just a master of adaptation. When diseases develop incredibly slowly, like over years or decades, our brains actually adapt to that new baseline. It's kind of like if someone was turning down the volume on a TV so gradually over a few hours that you don't even realize the room has gone quiet. If your vision narrows just a tiny bit over 5 years from glaucoma, or you slowly lose a little stamina from mild anemia, your brain just accepts it. It becomes the new normal, completely masking that physical decline from your conscious awareness. And the third reason is surprisingly simple. You just lack the hardware. Certain biological markers and internal structures simply do not have the sensory pathways to cause pain. You literally do not have the nerves to feel your blood pressure rising. You can't feel cholesterol floating around in your bloodstream, and you absolutely cannot feel the density of your bones decreasing early on. The alarm system just isn't wired up to those specific areas to produce conscious pain. Section 3, the smart screening strategy. So if we can't trust our own senses,
how do we bridge the gap between what we feel and what's actually going on? The answer is a targeted toolkit. It's designed to grab those objective measurements that our bodies completely miss. Simple blood pressure monitors catch hypertension, while blood and urine tests can reveal your glucose, cholesterol, and kidney health way before you ever feel sick. Throw in some medical imaging like ultrasounds or low-dose CT scans, plus specialized exams for your eyes or specific infections, and boom, we finally get a clear, objective window into our cellular health. But wait a second. Before you run out and demand every single medical test known to man, we need to pause. So the crucial point is, more testing isn't automatically better. In fact, just doing blind, scattergun testing can actually do way more harm than good. There are very real risks to overtesting. You open yourself up to false positives, and that can trigger a whole cascade of medical interventions. You might find incidental findings, tiny, completely harmless anomalies that would literally never affect you in your entire lifetime. All of this just leads to intense, unnecessary anxiety and sometimes even unnecessary invasive procedures. Let's be real. Feeding our inner hypochondriac is definitely not the goal here. The actual goal is targeted intelligence. As the source material emphasizes, screening should be based on evidence-based guidelines and individual risk factors. Your age, your family history, your lifestyle, your previous medical conditions, all of these need to dictate a highly personalized screening approach. A lifelong smoker? They might need a low-dose CT scan. A healthy 30-year-old non-smoker? Absolutely not. It is all about the right test for the right person at the exact right time. Section 4. When not to wait. Now, while we've spent this explainer focusing on silent diseases, there are some absolutely critical exceptions. Sometimes your body does break its silence. Unexplained weight loss, persistent fatigue, blood in your stool or urine, chest pain, difficulty breathing, a new or growing lump, or just any symptom that is progressively getting worse, these are your body's actual alarm bells, and they are ringing loudly. They demand immediate medical attention. This is not the time to try and tough it out. Furthermore, you shouldn't even wait for those symptoms to show up if you have a strong family history or known risk factors for a specific disease. If your genetics or past behaviors put you in a high-risk category for things like colon cancer or heart disease, having proactive discussions with a healthcare professional is absolutely essential. Please, do not let a lack of symptoms give you a false sense of security when the statistical odds are stacked against you. Which brings us to the central takeaway of this entire explainer. It's summed up so perfectly in this quote. Feeling healthy is a good thing, but it isn't a medical test. A total lack of symptoms just does not guarantee an absence of health problems. We have to shift our mindset from being purely reactive, waiting until we feel sick to go see a doctor, to proactively understanding the massive value of preventive healthcare. So I want to leave you with a bit of a challenge. Your body is incredibly good at adapting. And hey, sometimes that's a lifesaver. But sometimes it just means a disease is developing quietly in the background. So let's stop asking only, how do I feel today? And start asking, what does my objective health data actually say? Because when it comes to the silent health illusion, early detection doesn't just make a difference, it makes all the difference. So what is your data telling you?